Welcome to the Libman Education Coding Clinic Commentary Update for ICD-10, CM, and PCS, second quarter 2025. My name is Faye, and I will be hosting this session of our update. In this scenario, a patient with a past history of benign prostatic hypertrophy experienced visible blood in the urine after a Foley catheter was placed on the day before this admission. The provider documented that the gross hematuria was due to trauma to the prostate during the initial catheter insertion. How is this coded in ICD-10-CM? Coding Clinic advises to report codes N99.820, post-procedural hemorrhage of a genitourinary system organ or structure following a genitourinary system procedure. Because the hematuria was documented as secondary to trauma to the prostate during catheter placement, the correct diagnosis code identifies post-procedural hemorrhage, not a device complication. Y84.6, urinary catheterization, as the cause of abnormal reaction of the patient or of later complication, without mention of misadventure at the time of the procedure, and R31.0 to capture the gross hematuria. This patient is admitted for open reduction with internal fixation of a hip fracture. During the hospital stay, the patient accidentally pulled out their Foley catheter, which resulted in hematuria. How is this coded in ICD-10-CM? Coding Clinic advises to report codes T83.83XA, hemorrhage due to genitourinary prosthetic devices, implants and grafts, initial encounter, and R31.9 hematuria unspecified. In this scenario, the patient's hematuria was caused by the accidental removal of a Foley catheter, not by the surgery. The correct approach is to code this as a complication of the Foley catheter using T83.83XA and code the symptom of hematuria. You would not use a post-procedural complication code because the bleeding was not a direct result of a surgical procedure. This concludes the Libman Education Coding Clinic commentary for second quarter 2025. Thank you for joining us for this presentation. If you have any questions or comments, we would very much like to hear from you. Happy coding!